Hello guys, just wanted to talk about retinoblastoma classification. During my residency, we didn't get to see much cases with retinoblastoma. It was only during my fellowship I was exposed to patients with retinoblastoma. So during my residency, what happened was that theoretically we have to study about the clinical features, the classification and the management. And the classification and this all theoretically would stay in our minds for a few days or a few weeks, and whenever we come back after a few months, it used to look as new as as it used to look very new to us. And it was always confusing, the classification of retinoblastoma. Like we had Rees, Ellsworth and all, and we had the international classification of retinoblastoma. And interestingly, the retinoblastoma classification has been undergoing evolution and coming under changes, and it will get confusing to many students who are pursuing ophthalmology. And in this video, just wanted to go through the classifications right now being used and classification which was there before. So this classification is Rees-Ellsworth classification, which was proposed in 1960s. And usually whenever we are proposing a classification for a disease, we always think about the management. So in this classification, it was according to the outcomes related to external beam radiotherapy. During that time, the option available was primary enucleation or external or radiotherapy. So this classification was according to that management. Then chemotherapy was introduced in the 90s, and the new classification which is being used right now for management and for research. So this classification, called International Intraocular Classification Retinoblastoma, came, and it was first proposed by Alan Murphy in Los Angeles. So the Los Angeles version came around 2005, and after 1 year, Carol Shields from Wills Eye Hospital came out with the Philadelphia version, which was almost similar, only there was some difference in the group D and E version. So after having some studies and all, they found out their outcome was more, we can predict outcomes according to the Philadelphia version of International Intraocular Classification Retinoblastoma. But this too is being used in all research, and both are being quoted in some research, and some research quote only the Philadelphia version, some research quote the Los Angeles version, some literature doesn't quote any classification at all. And so this version of classification was according to the intravenous chemotherapy. So still now, right now, it's being used for classifying disease, and also we can predict outcomes, and we can tell the prognosis to the patient's family. Still there was some limitations like extraocular extension and all. It was the classification didn't, there was limitation, like didn't include the extraocular extension orbital disease. So what there's a committee called American Joint Committee of Cancer. So they, in 2017, they formed a committee and to classify this condition, retinoblastoma, and it was according to the TNM staging. So Recently, the latest one is the 8th edition of this classification, and this is the first time they have included a classification called H, which is hereditary. So they have the TNM staging, also they have the pathological classification, and they have this hereditary classification in this AJCC classification. So for now, right now, this ICRB, which is the Philadelphia version, which International Classification of Retinoblastoma, is currently being used in almost all institutes all over the world. And for research purposes, almost all except Reese Ellsworth, almost all, even though there's a classification called Children Oncology Group classification, which is similar to the ICRB, and they're all being used in all researches. And they have this prediction that in 10 or 20 years time the AJCC classification will take over, which is more evidence based and has more it can predict more outcomes with this classification. But for now, we are using, and which has proven, is the ICRB classification. Thank you.